Hormone health may be a major focus in the future of healthcare, as one Canadian company stands to prove after raising an oversubscribed $10 million Series A to scale its personalized, data-driven approach to treating hormone-related conditions. Here to share more about the company is Hira Siddiqui, founder of Science&Humans. I guess I should say co-founder here, but thank you very much for joining us today. We appreciate it. Tell us a little bit first about what your company is and what the focus is.
Thank you for the opportunity, and recognizing hormone health as a category is a great start and a great point to start this conversation. Science&Humans is Canada's largest digital health platform that specializes in hormone health for both men and women across different life stages. And our approach to delivering care is very unique in the industry. And that is essentially why we are becoming extremely successful in doing what we do today. We combine clinical protocols with wearables, insights, and biomarker data to deliver hyper-personalized care digitally at scale. That's essentially what we've been doing for the last 5 years, delivering care both direct to consumer and through large insurance companies and other distribution channels.
What's your major target market? Is it the end consumer? Because the end consumer is becoming more and more interested. Hormonal healthcare is hitting the news in a big way here, or is it the healthcare companies?
It is the end consumers in our D2C, distribution channel. Consumers are buying our services directly on our e-commerce website. However, on the B2B side of our business, our consumers, the customers, are large insurance companies and large employers. Of course, the healthcare consumers are employees of those organizations, but in that channel, essentially the healthcare services are purchased through insurance companies and employers, so both.
Now, you say you cover both male and female and a broad age. Are you not worried you're spreading yourself too thin trying to do it that way?
It's a really great question. We started off in a certain demographics of the market. We didn't start off with providing solutions across different demographics. As we scaled and the infrastructure built over time, both in terms of technology and scale, and our medical team exposure and expertise grew over time, we saw that the need was very well required across all different life stages, and both in men and women. The challenges are quite unique and different. And at the same time, there were challenges experienced by all of these demographics looking for evidence-based solutions in the market and seeing significant challenges in doing so. So over time, our organic growth strategy allowed us to cover all demographics and then both males and females. But we started off doing midlife first and then grew from there.
What about regulation? Is the regulations becoming more friendly, allowing you to do more of this, or is the government starting to really clamp down in this area as it grows?
No, we find ourselves extremely complementary, not essentially competing with the services available through the community providers today. There is a gap that is recognized both by the regulatory and through the B2B channels, insurance companies and employers, since they are very evidently today experiencing and observing productivity loss in their workforce and in employees. So we actually find ourselves extremely complementary, and we have so far not experienced any regulatory challenges.
And going back to your $10 million, the Series A, what made you decide on $10 million? And you oversubscribed, or were you surprised to see that?
We were not actually surprised to see that. Our journeys, I can, say that perhaps was a little bit different and easier relative to some of the other founders. We had been in this space for a few years, so essentially we had a proven track record of execution. The traction was there. We had some of the largest contracts with major insurance companies in Canada, and over 60,000 members on the D2C channel had already subscribed to our services. So we had a very healthy P&L. We were a cash-generating business. The requirement for the fundraise or the Series A was essentially to bring the money to fund our next stage of growth and really build that next generation experience in terms of technology and infrastructure that consumers are looking for in digital health solutions today. But in terms of our subscription round, it was very well expected, and we are very proud to have some of the largest most supportive investors today in the healthcare segment and industry today in Canada.
Now, you cover a wide target market. Are you finding there's more young people being interested in this? Because hormonal health used to be more of a concern for older people, but I get the impression that younger people are starting to get more interested in this.
That's a really good question. So I'll break it down into two. Especially, it's very evident and perhaps commonly known that hormone health does decline with gradual and natural age progression, both in men and women. So the demand and the requirement for hormone health evidence-based solutions is, of course, is a proven model in midlife and beyond. But on the younger demographic side, younger women in their 20s and early 30s do experience an entire spectrum of hormone health conditions as well, with PCOS, PMS, PMDD, infertility-related conditions. And those are all conditions that are experienced by younger females. And then on the younger male side, it's not very frequently spoken, but there are many different reasons why younger males are also starting to experience hormonal dysregulation because of the endocrine disruptors in our environments today, with stress and lack of movement and exercise and nutrition. These all essentially can become contributors to suboptimal hormone health conditions in younger males as well. So we have essentially access to some of the most brilliant minds in the industry in terms of medical advisors that are top endocrinologists, gynecologists, regenerative medicine experts that help us build these solutions that are extremely evidence-based. So we have protocols that are built both for younger males and females, and then midlife and beyond individuals as well.
Okay, Hira, we have to wrap it up there, but thank you very much for joining us.
Thank you very much for the opportunity.
Hira Siddiqui is co-founder of Science&Humans.